Hello, my name is Kashina Hur, and for this project, I chose Turner syndrome. Now, what is Turner syndrome? Turner syndrome is a genetic condition that affects females and occurs when one X chromosome is missing or incomplete. The population that is affected by this is 1 out of 2,000 to 2,500 female births. Some key symptoms are short height, webbed neck, swollen hands and feet at birth, and ovary difficulties, which can cause hormonal issues. Some key events are in 1930, German pediatrician Otto Ulrich described the first known cases of Turner syndrome. In 1938, American endocrinologist Dr. Henry Turner identified common signs and symptoms such as short height and delayed puberty. In 1959, Dr. Charles Ford discovered that Turner syndrome is caused by a missing or incomplete X chromosome, and this is named after Dr. Henry Turner. Some genetic pattern and cell patterns are: this is not usually inherited by parents, and it happens by chance, and it occurs due to an error in chromosome separation during the formation of the egg or sperm cells. And this causes one X chromosome to be partially missing. Some cell patterns are that half of the people who have Turner syndrome have one missing X chromosome in all cells, while the other half has a missing X chromosome in some cells, while also having some normal XX chromosome cells. Short stature homeobox SHOX gene. This helps control normal bone growth and is located on the XP2233 region of the X chromosome. In most people, they usually have two SHOX genes, but in people with Turner syndrome, they only have one working SHOX gene. Because of this, they have less SHOX protein is produced, which lowers the bone growth and results in being shorter. Some genetic diagnosis. Prenatal testing. Doctors can test amniotic fluid or the mother's blood to look for signs of Turner syndrome. Karyotyping. Cells are examined under a microscope to check if one X chromosome is missing. PCR testing. PCR copies DNA to help detect Turner syndrome and identify mosaicism when some cells have different chromosomes. Some complications in its treatments are heart problems. The treatment is medicine or surgery. Delayed puberty. You can go to estrogen therapy. Short stature. You can get growth hormonal treatment. Infertility. You could get fertility treatments. Some social issues and future research are prenatal screening. Early testing can detect Turner syndrome before birth and raises questions about pregnancy decisions. Education and support. People with Turner syndrome can live healthy, independent lives with proper medical care and support. Access to treatment. Growth hormone therapy can be expensive, which may make treatment harder for some families to afford. But some future research are stem cell research. Scientists use patient cells to study Turner syndrome and understand its effects. Genetic studies. Researchers are studying how X chromosome actively affects symptoms. Fertility options. New methods are being explored to help preserve fertility. The conclusion is that Turner syndrome is a genetic condition caused by missing incomplete X chromosome or missing X chromosome. It can affect growth, puberty, fertility, and overall health. Early diagnosis and treatments such as hormone and estrogen therapy can improve health outcomes. Research continues to improve understanding, treatment options, and support for people with Turner syndrome. Thank you.